I'm midwife Tyler and we're going to talk about signs of early labour. If this is your first baby, it can feel particularly anxiety inducing and scary to know when on earth am I going to know that it's early labour, when am I going to know when to go into hospital or call a midwife or call my doctor. Well, we're going to answer some of it today. So I want to preface this with, if you have any concerns, if you have any issues, that it's always better to just call. As healthcare professionals, we're always happy to answer the phone and answer any queries and calls, and prefer that you call and discuss what you're experiencing so that we can give you some advice rather than just having you guessing and worrying about it. So when in doubt, call. But some of the most obvious signs would be starting with abdominal cramps or period-like cramps. If you don't experience period cramps, then it can be like the cramps that you get when you need to have a bowel motion. So when it's really going into early labour, you'll find that these get longer and stronger, turn into contractions, and when you go into active labour, they will become more regular. So they'll come sort of every 2 to 3 minutes. They'll last about a minute. Now everyone can be different, but this is generally the pattern that we see in early labour. Another sign that some women get is losing their mucus plug. However, you can lose the mucus plug up to 2 weeks before labour. So it could just be something that's indicating to the cervix is opening, but you might not go into labour for another week or 2. It's still a positive sign of change though. Another thing that some people find is what is referred to as a bloody show. And what this is often a little bit of blood mixed with mucus, and it can indicate that the cervix is changing and that it is opening. Now it's important to note that if you're getting fresh blood and quite a lot of it, to definitely call your healthcare provider and get all those things checked. But generally with bloody shows, it is that smaller amount, and a lot of people will find they go into labour sort of 24 to 48 hours after this. Some people report just feeling different the day they go into labour, maybe a little bit sick or like something's a little bit off. It can be normal to have regular bowel movements or even vomit in early labour. But I would say one of the most important things to keep in mind in early labour is to rest as much as you possibly can. I know it can be super easy to get excited and want to rush to the hospital or rush to call people, but sometimes it can be long and drawn out, so conserving that energy is really, really important. Another way to add to your energy is using that time to eat. You might find your appetite decreases as you go into established labour, so eating lots of carbohydrates and really getting that energy in can be vital. If you're uncertain if it's early labour but you're really worried about it, then talking to your healthcare provider can really help ease those anxieties. Often they have a list of regular questions that they will ask to help do a bit of an assessment and decide whether you are in early labour or whether you're more in an active labour and they want you to come in.